this, all right? The next skill we're gonna be doing is perineal care, all right? Perineal care is a skill that we do all the time as healthcare professionals. It also happens to be a very tasking skill. Why? Because the steps are long. So watch and learn. Miss Susie is considered a human being, so all our pre skills and our post skills will be in effect over here, all right? So I'll shut the door for privacy. I go to Miss Susie, and this is what I will say. Hi, Miss Susie. My name is Cynthia. I'm going to be your senior for today, and I'm here to wash your perineum. We all know that perineal care can be a little bit fancy. You are not being graded on using fancy words, so you can say it in your own words. I'm here to change your pads, or I'm here to wash your genitals. I'm here to wash in between your legs. It means the same thing, okay? Don't stress yourself out. Write this down as for your equipment for perineal care, okay? One basin. We're gonna have 2 towels, 2 washcloths. You know, every time we get in water, we are also gonna use gloves. Then we have soap, and we also have pads. Okay, these chalks is also part of the equipment. I'm going out to get water as usual. Every time you see the basin, you know what's about to happen. The examiner is gonna come out with me to make sure that I test the water, all right? So again, stay put. I will be right back. Again here, just like our other washing skills, I'm gonna test the water, then I will fetch it. Dry your hands like we've been saying all along. When you've gotten about this much water, okay, this should be good enough. Wait for the examiner to come in, and you provide privacy. When you bring your water back, you ask your clients to test the water. Miss Susie, can you please test the water? Okay. Again, I'm going to demonstrate the scale by the wall so everybody can see what I'm doing. Okay, so I'm going to move my equipment close to me. My bath blanket on my patient to provide privacy, and I turn the tap sheet down to the foot of the bed. Okay, I'm going to bring this bed to a comfortable level for me, and when I finish, I would have to return into the lowest position. The next thing you will do before you start washing Miss Susie's genitals is for you to put the chalk underneath her. Okay. You can use different techniques to do this. As you know, Miss Susie is very heavy. Personally, I'm just gonna lift her and turn her towards me and unfold the chalk. The more you practice on her, you would get used to her, okay? You know, our patients and residents in real life comes in different sizes, so she's kind of heavy, but we should be used to that. Okay. you would only expose the area that you're going to be washing, which is the genitals. Miss Susie also happened to have a critical element, and the critical element for this skill is for you to correctly wash her genital area. We said for the female genitalia, we're washing from front to back, changing the side of the washcloth with each wipe. Okay. We don't go from the anus up, we go from front to back, also known as cleanest to dirtiest. All right, so that's what I would be doing. I would wet my washcloth, have soap, a little bit of soap. Okay, if you want to make a mitten out of your washcloth, you can definitely do that. Okay, so I'm going from front to back. One side, the side is considered clean, front to back on the other side. Then I do the middle, front to back. Okay, when I finish washing, I'm going to rinse. For rinsing, same thing. Front to back, front to back, changing the sides of the washcloth. Okay, and front to back. When I finish washing and rinsing, now I dry, taking the side or the corners of your towel. We do not rub the perineum, we use a dabbing motion because the skin there is sensitive. Okay, turn the side, another side to your towel and dry dabbing front to back. Now the middle, front to back. Okay, not that bad. Okay. Once I finish, now I have to wash the buttocks. Okay, to wash the buttocks, same thing. I'm gonna take my soap on my washcloth, excuse me, and I do front to back for the buttocks, front to back. So we'll do one cheek, another cheek, and then the last place we do is the middle. Okay, now rinsing. Rinse one cheek of the buttocks, the other cheek of the buttocks, and you rinse the middle. Okay, you want to rinse again because you feel like there is still soap. You can by all means do that by using the same technique. If you realize that you've made a mistake, let's say I'm doing front to back and for some reason I find myself going back and forth. For each GNA skill, you can make one mistake and correct yourself. When you make a mistake, you don't tell the examiner, oops. You don't tell the examiner, I'm sorry. You simply tell the examiner, I've made a mistake, and correct yourself from the point where you made the mistake. You don't start from the beginning of the skill, all right? So for instance, if I'm doing Miss Susie, I was doing everything correctly, but then I get here and I start doing this, I'll tell the examiner, I've made a mistake. I should have been washing or rinsing from the front to the back, okay? You don't start from the beginning, you just correct yourself. One mistake per skill, okay, to correct. Now that I'm done washing and rinsing, I'm gonna dry. Same thing, dab up, okay, front to back. Now the middle part of the buttocks will be last, okay. When you're done with that, this part is considered dirty. So now you have to remove it. It's part of the steps. That's how you end up with 19 steps for perineal care. You fold it onto itself. Cover her. Then you take the back blanket off. We said if we take linen out of the examination room, we've made a mistake, okay? So you get rid of your linen, your dirty linen, that is. Your chart is going into the trash bin. You're going out to empty the contents of this basin into the sink. You will rinse and dry and store it at the dirty utility area and then come back, all right? So I'm going out, the examiner comes with me. Empty the contents into the sink, rinse the basin, dry the basin, and store it at the dirty utility area. Excuse me. Take paper towels back into the examination room. We also say that if you do not bring paper towels, you can by all means use washcloths to dry the table. Okay. Miss Susie, this is your call light. My bed is in the lowest position and I'm going to wash my hands. Okay. This is my GNA exam, okay? I go to my patient. Miss Nafisa, I'm here to transfer you from bed to wheelchair. Is that okay with you? I'll be right back, all right? So the examiner will have a wheelchair for you in the room. You'll get your wheelchair. The next equipment I said I will need is what? A gait belt, also known as a transfer belt, all right? So I bring that with me. When you bring your wheelchair, when you want to separate a wheelchair, you simply or have a wheelchair ready when it's folded. This skill we also said has two critical elements. One of the critical elements is before the patient gets in the wheelchair, you need to lock the wheels of the wheelchair, all right? The examiner is watching me, they're not speaking to me. Another thing that we need to do when we are using a wheelchair is to fold the footrest. So if the footrest is not folded, okay, you are responsible for what? Folding it, okay? The next thing we will do, which is part of the critical element, is for you to tell the examiner you would lock the wheels of the bed, all right? All what I'm doing, everything that I'm doing is part of the what? Steps. That's how we got to 15 or 14 steps for this particular skill. This is the next thing I would do, okay? Fan fold the top sheets of the linen of your patient, okay? We also said we need the patient's shoes. So I'm gonna be using the bedroom slippers, okay? I tell the examiner, I've already told the examiner, my bed is locked in position and my bed is also in the lowest position for safety. This is how we transfer patients when we are moving them from bed. You're gonna support the patient's abdomen, support their back. Miss Nafisa, can you please help me sit up? Okay, sit you up. Then you go behind their knee and transition them. Please come to the edge of the bed. As you see me, when you start the examiner is going to tell you the patient is alert and oriented, so you can give them instructions to help you, and they would. All right. Once your patient is in this position without their feet touching the ground, all right, the next thing you will do is to apply the gait belt on the patient. If you think your patient is too tall and their feet might touch the ground, you can ask them to scoot back. So actually, I'm gonna pretend she's too tall and her feet will touch the ground. I'll give her instructions. Mr. Fisa, can you move back? So very good. Okay. To apply a gait belt, we said when we put a gait belt on a patient or a resident, it needs to be snugly, not too loose and not too tight, all right? So you put your palm, your open palm, in between the patient's body and the belt so that it's not too tight or too loose, and just simply adjust it. The excess belt should always be tucked in, all right? Now that I have my gait belt on the patient, I'm going to put the shoes on the patient. Okay. Now I'll ask my patient to scoop to the edge of the bed now, Mr. Fisa. Okay. Now scoop to the edge so that your feet touches the ground. If the patient's feet does not touch the ground before you move them, we've made a mistake, guys, all right? So make sure that the feet touches the ground. I'll bring my wheelchair a little bit close so we are not walking too far, all right? Now, this is the next thing you do. You're gonna support the patient's knees with yours. Ask your patient to wrap their hands around you and tell the patient, give the patient a cue, okay? Miss Nafisa, on the count of 3, we will stand, all right? 1, 2, 3. Stand up, please. Very good. Now we're gonna pivot, walk to the wheelchair and sit down for me. Good job. That's how you should sit your patient in the wheelchair. Once your patient is in the wheelchair, your next step is to go behind them like this and not like that in the gait belt, all right? Fingers up and bring their hip to the back of the wheelchair. It's a step. The examiner is watching you. Bring the patient's foot on the footrest. Okay. Miss Nafisa, this is your call bell. If you need me, do not hesitate to call me, and I'm going to wash my hands, okay? You've done or you've completed this skill. All right, you can stand up for me, please.